A retired NYPD sergeant was found dead on the street of coronavirus in front of the Upper East Side Hospital where he was diagnosed with the deadly bug just an hour prior.
Yan Chong, 56, was diagnosed with COVID-19 at the Lenox Hill Hospital early Tuesday.
He was reportedly frustrated with the care he received at the hospital and left, but he collapsed on the very same block near Park Avenue and East 77th Street shortly after around 6:05 a.m. and died at the scene, according to the New York Daily News.
An autopsy will be performed to determine the exact cause of his death.
Chong forcibly discharged himself from the hospital because he was unhappy with the care he received, sources said to the New York Post.
Chong was appointed to the NYPD in February 1994 and promoted to sergeant in December 2006. He retired from the force in February 2014.
It's tragic. We extend our sympathy to his family. It's almost like a science fiction movie. This isn't ending, and the impact of coronavirus is hitting the people who are closest to us, Ed Mullins, the president of the Sergeants Benevolent Association, said on Chang's passing.
This is a sergeant who was at the point where he was retired, and he should be enjoying himself, he added.
In the U.S., there are more than 400,000 cases of COVID-19 and 12,000 deaths.
New York is the epicenter of the outbreak with more than 138,000 cases and 5,000 deaths in the state as of Tuesday. In New York City, there are more than 77,000 cases and 4,000 deaths.
Tuesday marked another devastating day for the country as the coronavirus continues to claim lives.
In Louisiana, an elderly mother and her 3 sons all passed away from COVID-19 within days of each other last week.
Antoinette Franklin, 86, from New Orleans along with her sons Herman Franklin Jr., 71, Anthony Franklin Sr., 58 and Timothy Franklin, 61, all died from the disease between March 20 and 30.
My uncle passed, my grandmother passed, my dad passed, then my other uncle passed, Anthony Franklin Jr. said to NBC News.
It is not clear if they were tested for COVID-19 before or after they died, and their underlying causes of death have not been revealed. However, all 4 of them became ill at the same time.
I want the world to know if it happened to the Franklin family, it could happen to any family, Jacqueline Franklin, wife of Anthony Franklin Sr., told WDSU.
Let's take this serious. My children have to bury their father, their precious grandmother and their uncles.
New Orleans has emerged as one of the early U.S. hotspots for the coronavirus.
The death rate in New Orleans is almost twice that of New York, with doctors and public health officials blaming the Big Easy's high levels of obesity and related ailments.
Meanwhile, in Pennsylvania, the Brighton Rehabilitation and Wellness Center nursing home has announced that it should be assumed all residents and staff have COVID-19, after at least 13 people at the facility have died in connection to the deadly bug.
In Pennsylvania, more than 14,850 cases had been confirmed as of Monday afternoon and there were 179 related deaths. But within Beaver County, it's believed the number of cases and deaths are worse than it seems.
On Friday, a source told the Times Online that at least 8 people at the nursing home with 450 residents, staffed by 300 people, had died from COVID-19. By Monday, an insider said the number of deaths had leapt to 13.
The number of cases on Friday was 42, but as of Monday it was 96. Union officials said 13 of them were employees.
The total number of cases at the care home amounts to more than 82% of the confirmed cases in Beaver County, which was only reporting 6 deaths as of Tuesday, according to Johns Hopkins University data.